Hi, I'm Dr. Randy Jones, and this is my wife, Dr. Molly Edwards Jones, and together we run and operate the Castroville Chiropractic Clinic here in Castroville, California. And we've been in practice since 1982. We've treated thousands of people, and we only take the cases we believe we can help. That's how we have such a high success rate. We have patients that come from many miles away to receive the kind of care that we provide. We have a comfortable office. My wife is a registered nurse and a chiropractor. And it's unique because we have a husband and wife team. We have 4 qualified staff that are here to help patients with their insurance and help to process all of the paperwork that they need. We have a bilingual staff, so we treat people that are Hispanic and Spanish speaking and also English speaking. We treat a variety of cases. Our practice is family oriented, but we do see a lot of athletes, we see a lot of children, and we see a lot of geriatric cases. And the type of thing that we deal with is we deal with what's called subluxations. In chiropractic, we all know that the brain controls the body, and it uses the nervous system to control the body, and there are areas where the nerves can become pinched, and that condition is called a subluxation. When that happens, what we do in chiropractic is we find those areas, we relieve the pressure on the nerves, and then allow the body to do what it's designed to do, and that is to function normally. Yeah, I want to show you what a subluxation can do in the body. Now, both my wife and I attended Palmer College of Chiropractic in Davenport, Iowa. And the school is very strong in its philosophy and in its understanding of the nervous system. Now, chiropractic cannot cure everything, and we want patients to know that. We work closely with specialists. We routinely refer out for x-rays to readings by specialists, for MRIs, for neurology cases, for orthopedic cases. There are some cases that wait too long and they need surgery. But the whole point here is that the nervous system is functioning properly and your spine is in relatively normal alignment, it can last for a long time and there can be motion in a spring-like mechanism. But if you allow the body to be kept out of place, or you have subluxations or a change in the curvature in the spine, it will put the weight on the front of the vertebral bodies and then eventually start this degenerative process and start this wear and tear, and then it can cause a narrowing where the vertebrae come out and bone spurs that can form. So it's better to not put off chiropractic, come in early and have a checkup. If a person has a subluxation or vertebra out of place in this area, these nerves go down the arm, and the type of symptoms they could have is they could have numbness and tingling in the arm, they could have difficulty in grip strength, or shoulder or elbow problems, or wrist problems, because they can be weakened. The tissue does not receive a normal nerve supply and it can become weakened. These areas also do affect the heart and lung region, and we know that for a fact that when a person has a heart attack, they receive the impulses down the arm, and so that's one of the main symptoms of a heart attack is pain down the arm. So we know the nerves are tied together. The heart and the arm are definitely tied together. But the same is true in the low back. These nerves go down the legs, and it's very commonly known by neurosurgeons that if a person has a severely pinched nerve here, it could affect their bladder and their bowel function. And so that is checked when we discuss this with patients. So we know for a fact that these nerves, not only do they go down the leg and they can cause weakness in the knees and ankles and leg pain and hip problems, but they can also cause problems into the bladder, the female organs, into the reproductive organs, and into the colon. So it's very important that patients get the care early on before these conditions progress and a person gets worse. Okay, I want to show you the difference between a normal x-ray and an x-ray of a person that is in antalgia or in pain. Antalgia means away from pain. This patient came in bent over to the left and was not able to come back to the right. They were in severe pain. They had low back pain and they had leg pain. They also had been having this for many years and put off doing anything about it. When a person has this kind of a condition going on, we look to the low back and we can see here that at this level there is a thinning of the discs, and there's narrowing of the area where the nerve comes out. You can also see there is some degeneration of the disc taking place in this spine. This person can get great results. In fact, Shortly after this, within a week, they were walking upright and they were 50% better with their pain and their symptoms. Well, we encourage people not to wait too long, and if they do have a problem, come in as soon as possible so we can prevent any complications.